Hi, my name is Nico and I'm the registered dental hygienist here. I'd like to talk to you today about periodontal disease and Arestin therapy. Let's go for the periodontal first. So, as you know, you've been diagnosed with periodontal disease. Periodontal disease comes about when you have bacteria that sits on your teeth and causes a deep pocket in your gum tissue. This can affect you in many ways, including bone loss, tooth decay, sinus infections. It's a whole host of issues that will come about, and it's almost like a circle effect. So if you don't treat this, you can end up with a very serious issue with your sinus cavity, with bone loss, with tooth decay, with tooth loss, which, is a whole nother issue. That being said, Arestin therapy can stop periodontal disease in its tracks, thus the name Arestin. It arrests periodontal disease and infection by killing the bacteria that causes the deep pockets in your gums. The Rural Institute for Health has written several papers on the matter and has decided that Arestin therapy is one of the best frontline treatments for gum disease and periodontal disease in patients with this type of illness. I'm just looking at my screen so that I can give you some information that you can use to take with you. Now, if you just focus your attention for a second on this. Okay. That is the screen for the Arestin therapy and how it affects the gum tissue and how it will help you to keep your teeth in your mouth instead of having severe bone loss. Basically, that screen was showing you that if you don't confront your periodontal disease, you will have bone loss, you will have tooth loss, you will have lots and lots of pain. Now, the way that Arestin therapy works is that it's a seed-like medication that goes into the gum line, and it sits on your actual roots of your teeth, and it helps to kill that bacteria which causes the periodontal disease. Again, as I was saying, several papers have been written on Arestin therapy and the fact that it is one of the best frontline treatments for periodontal disease today. I know for a fact that it works because I myself am a perio patient. Even though I'm a hygienist, I have also been a victim of not flossing enough and ended up with periodontal disease. When I used the Arestin therapy, it actually got rid of the pockets in my gum lines completely. So this is an excellent treatment. I recommend it to all my patients, and I'm hoping that you will also find that it was helpful for you. What else can we talk about with the Arestin? I believe that might be it. We did talk about that it gets rid of the inflammation that causes the periodontal disease also. Yes, that is also something that we have to address. Inflammation from the periodontal disease is directly affected because the antibacterial agents in the Arestin therapy keeps the gum tissues from becoming inflamed. Inflammation will stop circulation from going to your gum lines, thus making this vicious cycle. So Arestin again gets rid of the inflammation, gets rid of the pain, kills the bacteria, and helps heal the gum tissue. I hope that you found that this was helpful, and I'd like to make an appointment so that you can come in and get started.